Well, thank you for the introductions there. We're happy to be on here from ABM for the Silicon Valley BOMA, Building Health, Instilling Confidence at Work. What I'd like to start off with a moment of safety. And this is just a general reminder of ways to stop the spread of germs, and which is pretty much, you've probably heard a lot of, and pretty redundant, but it's very important. Is have the social distancing, and try to avoid touching your eyes and nose and mouth, cleaning, disinfecting surfaces, washing your hands with soap for 20 seconds at least, covering your cough or your sneeze. And one of the things that probably a lot of us will be getting used to is staying at home when you're sick rather than trying to get into work. Here are some of the items that my colleagues will be discussing on this call. What you're going to get out of this is a picture of what property managers, tenants, and on-site service employees will be preparing for acting upon when we transition back to the workplace. Impacts of COVID-19 on the cleaning industry before and after. We understand that the challenges you faced pre-COVID have not gone away. We find that others in your same position are facing challenges like attracting and keeping clients, keeping property assets at an all-time high, budget challenges, operational efficiencies, SOPs and technology, and limiting liability, safety, and risk is a vast importance. Here are some questions you may be coming across. How do you see COVID impacting your building? What unique challenges will you encounter? How should you develop your operating plans? How should you get resources needed to address new cleaning protocols? Property managers are faced with a heightened demand to their tenants that they are providing a clean, safe, and healthy building. Wellness is the buzzword here. Your tenants are trusting you to keep them safe in an unprecedented time where you are facing challenges like new challenges, like reoccupying buildings and communicating new safety guidelines for tenants, understanding new cleaning protocols, maintaining occupied and unoccupied buildings, reviewing scopes of service, reallocating budgets, and future possible outbreaks of COVID in your building.
All right, so tenant trust is at stake. According to the 2020 Edelman Trust Barometer, consumer trust in U.S. institutions is woefully low. Now more than ever, there's a heightened demand to demonstrate that you're providing clean, healthy, safe, and sustainable spaces the tenants can trust after the virus has been cleared for years to come. The challenges you're facing and the choices that you make to address them are viewed by your community through the lens of trust. So people remember how you respond in times of crisis, and the time to build trust is now. We say the time to build trust is now because this is not the first crisis, nor will it be the last. The strategies and partnerships formed now impact to conquer today's challenges and prepare those for the future. So take a deep breath. We're all in this together. There'll be a team effort for all parties involved. Vendors, property managers, and tenants will need to play their role into safely and methodically getting us back into your workplace. Communication will be at an all-time high. Vendors, property managers, and tenants will all need to play their new role in a safe and methodical way of getting us back into your workplace. Acting quickly to any concerning matters is key. Having revised protocols for all services within the commercial building is paramount. Safety precautions. Contractors should employ PPE, reusable cleaning cloths with disinfectants, workers wearing goggles, reusable face masks, and gloves for enhanced cleaning. Why? Well, to protect the employees on staff, the site, and your environment. Your contractor should engage with their safety service delivery, and ops team to ensure information is shared and needs of clients and team members are met. If any of your team members exhibit symptoms of COVID-19, the contractor should send the team member home immediately. According to the CDC, employers should inform others in the workplace of a possible exposure to COVID-19, but you must maintain this information confidentially as required by the Americans with Disability Act.
Your contractors should put in place an SOP and share that with you. An SOP would cover basically their services that they're going to provide under the contract or additional scope that tenants or you yourself may request. And SOP should be shared with the entire staff and trained as well.
Okay.
Enhanced cleaning programs vary from site to site, but the basics are the same: encouraging hand hygiene, signage, using the proper disinfectants, which are EPA registered disinfectants. You can find a list of those on the EPA website. And then increasing frequency, whether it's periodically or daily or multi-times a day. The periodics are important to disinfecting. We wanted to share with you the different definitions of cleaning. Sometimes there's a little bit of confusion here. General cleaning is basically what most buildings have been doing in the past, and those are usually green seal products, and that basically removes germs and dirt. Sanitizing is typically done in restaurants, food prep, kills some bacteria, but it's not disinfecting. Disinfecting is actually killing germs and viruses. So we're seeing buildings and clients asking going from general cleaning to disinfecting. So your contractor should really start engaging you as far as what products they're going to use going forward for disinfecting.
With everybody being on the call, you're already starting to think about the process. So the first piece is, do you have a process in place? You should have an implementation process that has been tested to mitigate the risk of transitions, so your confidence is high going into this transition. So a couple things to think about through this process are, do you have an enhanced cleaning program at the start of the transition phase? Do you have a procurement support to help with priority projects to improve buildings readiness? And also, do you have a dedicated transition team that works with you through every step, providing communication and transparency to ensure a smooth conversion? So the first part is the pre-transition. Your pre-transition should start with an assessment of current conditions at your buildings. Communication with all parties involved, tenants, vendors, etc. Create a transition plan. And then moving into the transition, you execute the transition plan with training the employees. You have your teams focused, everybody should be aligned, understand what their roles are, and then make sure the leadership is present to outlay the message. And then post-transition, make sure there's a consistent service delivery. So ABM uses, these are our top 3 products being used. I think the idea here is that we used to focus on going green, but with this pandemic, going green might be a thing of the past. What we're seeing now is more of a future for disinfectants and the frequencies that each property manager will need to decide on how often these disinfectants are being used. So we've got Oxford here, Virex, and Alpha HP, and these will depend on what you want to use at your site as well as what your contractor can use. This gives you an example, 2 products, 2 pieces of equipment that are used for the spraying of the chemicals, COVID cleans, for example. So Pro Texas and the Clorox 360. So they're highly efficient, they're cost effective, and they're ideal for high touch services as well as non-toxic.
So the new normal. So some things you can start thinking about as you open up is just making sure that you have new processes and procedures in place. A lot of you guys have started already having these discussions with your contractors. So some things to think about are making sure that you have updated signage, CDC posters, your contractor safety posters, your enhanced services menus available, or your contractor's enhanced services, and their deep cleaning services, whether it's a one-time or a post-COVID clean. You want to start also considering some procedures in place to reduce exposure inside the space. For example, if you in your main lobbies, if you're going to have a hand sanitizer station, you should always put a waste bin next to it. The theory is that somebody walks in with gloves, you want them to dispose of the gloves, sanitize their hand, and then go into the space instead of cross-contaminating the space. Some recommendations for the tenant side is to temporarily remove any lids from trash bins, recycling bins. That's basically another high-touch area that you can basically cross-contaminate, and it's just another thing that you're going to have to disinfect often. So it's wise just to remove the bins, the bin covers for now. Also, tenants have cabinetry that have bins. That's another high-touch point. It would make more sense to remove the bins outside of the cabinetry for now, so that you're eliminating that high touch of the cabinets and the sanitizing of those often. If you guys don't have central waste collection, you might want to consider doing central waste collection. It eliminates the janitorial staff from going desk to desk and touching bins and cross-contaminating. So it's making a safer environment for the employee and the janitor. If you don't have a re-entry checklist, it's wise that you Google some. There's some out there, or your company may have one for you. ABM also has one. If you're interested, you can reach out to Sue or Gary. But there are checklists out there that things you need to think about as far as re-entry, not just on the janitorial side, but the HVAC, parking, and landscaping. So it's wise to have that and follow those as a part of your procedure.
We realize that there are questions asked about your current building situation. This is the time to address them. They are saying that it will take at least 2 to 3 weeks to prepare for transitioning back into the workplace. If you're a current client of ours or would like to discuss in further detail of what ABM is preparing for, feel free to reach out to us, as Antonio said. ABM self-performs 90% of its services within and around commercial building. These are some of the services that we offer. We have an enhanced cleaning solutions to help our clients prepare for the eventual return of tenants, customers, and our employees. In closing, during the meeting, we discussed the impacts of COVID before and after, and the trust that your tenants are expecting from everyone involved. We also mentioned the response to the crisis and the measures needed to make important decisions to ensure the wellness of your building. Disinfecting will be the wave of the future. And lastly, we discussed the new normal and how reopening, enhanced services, and de-cleaning will be important steps to achieve the wellness that a commercial building will need. Thank you and stay safe.
Now I'd like to introduce the next speaker, James Fisher from the Pruneyard Towers.
Hey everyone, just like to go over and review air quality and tenant comfort. Maybe just review some of the basics on really how to achieve that. Indoor air quality, bringing in a minimum of outside air into the buildings. All buildings are capable of this. All of them do. How they're done, minimums are based on an engineered building specification. Everyone has outside air dampers. When the building's built, they're all engineered to spec based on the square footage of the building and the occupants in the building. The more you grow, the more occupants, the more they can size up and really let you know the minimum outside air you need to bring in to achieve this. It could be 10%, could be 15% at all times. Again, an engineer would have to review that and let you know. You can set that up on the building's BMS or however however it's done well to get done. Note, just for yourselves, there's about 20 CFM required per person in the building. They will use that to help size the space. Another way is CO2 monitoring. You pretty much see that in conference rooms, large gathering areas, lobbies, things of that nature. If you're ever in a meeting, maybe there's a lot of people in there, that could be the problem. Some of it could just be poor airflow. So you'll see CO2 monitoring in this area. Again, it's Title 24, been around for a while now. And if, at the end of the day, there's not very many people, the symptoms seem to be consistent, have it checked out. Again, the CO2 monitor will tell you. Something here at the bottom, maintaining penthouse PMs, you'll see I kind of put on every page, something you really can't look past ever. And it'll be beating the horse here, but you'll see it, and it's just, to reiterate enough, it really needs to be maintained. Filters, next slide, please. Filters are changed regularly, annually, and biannually. Depending on the application, they can be changed more. You could be next to an airport, maybe a low-rise building, above a very crowded area, streets, restaurants, etc. Could be changed more. Typically, filters are changed annually and biannually. MERV ratings, well, not just yet, but we can go to the next slide eventually. Differences in applications. MERV ratings are the efficient rating value of the filters you're using. Each application is different, so the chart will show you what is best for your property. And UV lighting, I'm sorry, UV lighting. UV lighting's kind of, it's been around a while. I believe it's going to be coming back in a major way, at least up in itself. You'll see it more, applied to buildings moving forward, I believe. How it works, photons transmit electromagnetic energy when they encounter matter. The ultraviolet light has high levels of energy. They measure that in nanometers. A properly designed and maintained UV system, often in concert with filtration, humidity control, and airflow management, has been shown to reduce infections from their viruses. The details of the system are very important. The design of fixtures, the lamp type, the lamp placement, airflow, amount of mixing, etc. Simply adding the UV system without consideration of these factors just listed has not been demonstrated to have any benefit. So they're great to do, great to have. Again, I think it's going to be applied more and more as time goes on. But I would definitely hire the contractor to do it, but definitely hire the engineer to specialize in this area to look forward into getting it done and size it up for you, where to place it, everything listed here, etc. I added a couple links below for your own knowledge. You can click onto this at some point. You're going to start looking into that and just kind of research yourself, educate yourself a little bit. And again, here we are maintaining penthouse PMs. Just can't stress that enough. Next slide, please. Here we have the MERV chart I was explaining to you. They vary per application. On the far left here, you see the standard MERV ratings and the energy efficiency, what they are. To the very right will show you what they're best applicated for. I'm sorry, second to the very right. So again, per your building, per your application, things can change. For example, for our property here, we have two sets of filters. We have a pre-filter, which we use our MERV 8. They're good for commercial buildings, better residential, etc. We also use MERV 13 as our bag filters. Here, as you see, it's got hospitals, general surgeries, smoking lounges, and superior commercial buildings. That's what we use here at our property. Your property might be the same, again, depending on the application. It could be higher MERV rating. You might not need something so existential. But this is, again, for your own reference. You can keep kind of reference what your buildings have, your application, and what you're using. Next slide, please. So last but not least is coil cleaning. Coil cleaning is just as important. The first line of defense are your filters. Like I said, right behind your filters are the coils. That's where they sit. They impact your air quality tenfold just as much. With all the moisture around the evaporated coil, it can become a breeding ground for bacteria and mold. As much as we have the filters in there, and they're there to block, 99% of efficient pollens and dust allergens and everything like that, they can still somehow, some way get through. The coils condensate, they have pans, all that gets out down there, washes away anything in the pans, but doesn't wash away dirt and debris that's sitting there stuck to the pan. With that, all of that is also stuck to the coils as well. These are all basic PMs. These are very, very good to follow up with, as well as coil cleaning. You do that a couple times a year, maybe once, maybe twice, again, depending on your application, budgets, the building, the team, etc. But typically what I've seen, clean it very heavily once a year, maybe rinse off twice a year, both annually and biannually when you change your filters. The coil cleaners used, there's acidic, alkaline, solvents, and mold and mildew inhibitors. Clean and rinse thoroughly. Again, your coils can be different. There's steel, there's aluminum, there's copper, there's age, there's environments. All of these vary in what is specific for your application. There's ways to clean them. Everybody who does clean them should know when you rinse your filters or your coils. Clean your coils. You like to spray it down with some alkalinity and some solvents. Maybe if you need to use acid if it's that bad of an environment and your filters aren't holding up. You can do that, but you don't want to leave it on too long. Just for your own knowledge, that will leak through the mechanical at some point. So if you're using acidic coil cleaners, definitely keep it light. Alkaline solvents, mold and mildew inhibitors, those you like to leave on for about 30 minutes or so. Rinse thoroughly, very, very thoroughly. Again, follow up with some mold and mildew inhibitors. That definitely helps with any scent, anything left behind. Really definitely clean. When you're done cleaning, you definitely want to dry the area as well. Vacuum up any moisture, vacuum out the pans. Change the chemical tabs, everything. That's how you properly clean your coils, again, at least a couple times a year. The best time to do these are spring and fall. So you pick up your most pollen, your dust, debris, things get kicked up. Best time to do it are those 2 times. And again, to end it, maintain penthouse PMs. That doesn't mean go in visual and pick up garbage. It's definitely part of that, but vacuum, mop, sweep, wipe down your pumps, your boilers, vacuum the walls, wipe the fans down, things of that nature. It's simple. We like to get it done once a month if you can. The cleaner it is, the better your air quality will be. And maintain your penthouse PMs, and that's about it. Thank you.
Now let's turn it over to the Q&A portion.
So we received 2 questions, one via email and one via the chat box. I'll share the first question. The first question we received is, we all know that more frequent cleaning, especially for high-touch areas, are recommended to combat COVID-19. Tenants are pretty much expecting that somebody will follow them around and disinfect everything they touch right behind them. That's not really a realistic expectation. How do other property managers deal with this?
Typically, it's just educating the tenants and asking them or directing them to the CDC guidelines and what is recommended for disinfecting and how frequently. Most buildings, what we're seeing is they're putting that frequency onto the tenants. If it's in their space, buildings are usually handling the common areas and restrooms.
The second question we received via the chat. Our engineering team mentioned that using MERV filters will affect airflow for the HVAC system, which may end up not getting enough airflow. Any comments or suggestions so we don't end up having to do a whole building adjustment or overhaul to accommodate?
Well, with any building, those filters do create some restriction, and your static pressure might go up in the building, your duct static. You can lower race band speeds to accommodate if needed.
We have another question. Will the cleaning products wear down door handles and other surfaces faster?
A lot of the sealant products are water-based sealants. So yes, if you're spraying, a disinfectant which is water-based more often, and you're rubbing the surface more often, there will be some wear. So yes, you can expect some wear on doors and finishes.
We did receive another question. Approximately for the panel, approximately how many surfaces can you clean with one disinfecting wipe? I see people wiping and wiping, but are they just spreading the germs?
Disinfectant wipes are really to clean an area that's already cleaned. So part of the disinfecting is there's steps to it. There's cleaning and removing dirt and debris, and then there's disinfecting. So ideally, if they're using wipes, they should be using wipes until they see some discoloration on the wipe, or the wipe no longer has a disinfectant on it. But it shouldn't be used as a way to clean a surface if it's dirty. You should clean first and then disinfect.
Our next question for the panel is, once reoccupancy starts, what is the recommended frequency of cleaning restrooms and elevators?
Well, it depends on what type of, if they're going to have their current scope of work in place, so they can then go with the option of enhanced type of disinfecting. Recommendation would be, I would say, you have day porters at least a couple times. I'm hearing some clients that are looking at even 3 to 4, some even saying 5 times for high touch areas. So it's really going to depend on the contractor and the property manager teams to discuss what's best options and what's the frequency of how much foot traffic is going into specific restrooms per se, and like on the first floor compared to any given floor above.
And you might want, just to add to that, you want to look at your traffic flow as well. So mornings and afternoons, they should be disinfected more often than between the lunch hour and the start of the shift, and the lunch hour and the end of the shift.
Our next question for the panel, just heard about nanotech surfaces that are supposed to, quote, self-clean. Does anyone on the panel have additional information or thoughts about these types of, about this stuff?
It's referring to the surfaces that go over the elevator buttons or doorknobs, etc. There's a lot of buzz about this right now, but this has been around for a long time and it's not quite proven yet. Still a lot of research going on, so we can't offer any guarantees or really any suggestions on this, other than just making sure your spaces are cleaned thoroughly through disinfectant. So I wouldn't rely on this until it's a proven concept.
Our next question for the panel, does anyone on the panel have a suggestion on how to get hand sanitizer, face masks, and other protectants for their office buildings?
There are a lot of local manufacturers and distillers making hand sanitizer. They're making it in volume. Obviously, it's hard right now to get the Purell or the other mainstream hand sanitizers. So a lot of companies and businesses have gone to buying bulk and refilling bottles with hand pumps. So that's an option. I believe as we reoccupy, there'll be more of a demand. So bulk buying is probably your best bet right now in order to keep up with the demand of the use.
Our next question for the panel, do you anticipate increasing staffing both at day and night based on the disinfecting requirements tenants will expect? Or will this be tenant driven and a price absorbed by the tenant?
the question, to answer this, it's going to depend on what the expectations are coming out of it. It's going to take, for example, to have restrooms done about 3 times longer to disinfect a restroom on each visit for the porter. So if there's additional staff, then there could be an additional expense, yes.
Our next question for the panel, would you please describe the difference between fogging and electrostatic disinfecting? Afterward, how soon can employees reoccupy the building? Are these processes safe for computers and other office equipment?
Foggers and electrostatic. So electrostatic sprayers are putting an electrical charge in the product that's being sprayed. And what that does is it allows for the product to wrap around a handle or a phone or whatever it is that you're spraying. Most of these sprayers, and we've seen a few of them, some of them have heavier droplets than others. We don't recommend to spray direct onto electronics. It's best to spray onto a rag and then wipe. And then also based on the product that you're putting into these units, some are better than others depending on how much time you have. If it's being done at night, it's fairly safe, you know, for occupants to come in the next morning. So there isn't a long wait time to reoccupy. So just be aware of what products are being used and what type of equipment is being used when sprayed.
So that was the last question that we had in the queue. Are there any other questions from the attendees on our webinar today? Okay, if not, I'll turn it over to Diana. Thank you.
Thank you. Thank you all for joining us today, and thank you again to our speakers. We hope you found today's workshop informative, and please look out for an email from BOMA with a workshop survey to let us know how we did. Take care, everyone. Be safe. Thank you.